Mandy. I'm going to perform a sterile dressing change and don sterile gloves using the open technique. I'm going to follow all GPSP guidelines, my 11 rights, my 3 checks. I'm going to knock on my patient's door, enter, perform hand hygiene, introduce myself to the patient, tell them I'm the nurse taking care of them. I'm going to perform their sterile dressing change. I'm going to get their consent. I'm going to check their name and date of birth against their wristband, and I'm going to assess for any allergies. I'm also going to see if they're in any pain, do any pain related interventions, and I would prescribe, or I would give them their prescribed medication as ordered if applicable. I'm going to do hand hygiene, and then I'm going to put on some clean gloves. I'm going to remove the soil dressing using the push-pull method, starting at the edges and working my way around the dressing. And if necessary, I can use some sterile saline to moisten. Then I'm going to pick it up from the center. I'm going to note the type, the amount, the color, and the odor of the drainage on the dressing. Then I am going to dispose of the dressing in the trash. I'm going to perform hand hygiene. I'm going to assess the wound. I'm looking for the size of the wound, the appearance, any drainage, and assess the patient's pain around the wound. I'm going to prepare my sterile field. I'm going to grab my dressing tray. I'm checking the expiration date. I'm making sure it's dry and the package has not been opened. I'm going to open. I'm going to grab my sterile gloves. I'm also checking the expiration date. It's not open. The package is dry. I'm going to open my gloves onto a clean, dry surface that's above my waist. I'm going to perform hand hygiene. I'm going to open my gloves. We'll perform hand hygiene again just because I touched that. Going to open my wrapper. I'm only going to touch 1 inch around the border of my wrapper. Using my non-dominant hand, I'm going to go in and grab the glove with my thumb and index finger. I'm going to step back. I'm going to insert. I'm going to use my fingers to go in, grab the cuff, this glove, step back, put on my gloves. I can adjust my cuff. Now I'm going to grab my swabs. Then I'm going to clean the wound from the top to the bottom, or I can clean from center to the outer edge. I'm not going to cross over my wound. I'm going to do 1 swipe down the edge. I'm going to dispose of that swab. I'm going to do 1 swipe top to bottom around the other edge. Dispose of that swab. I'm going to top to bottom down the middle, and I'm going to dispose. I'm going to take clean gauze and I'm going to dry from top to bottom. Again, top to bottom. And one last time, top to bottom. Dispose of that. I'm going to dispose of my gloves. Wrapper. I'm going to perform hand hygiene. I'm going to open my gloves. I'm going to open my package. Again, it's a clean, dry surface. It's above my waist. Keeping at that 1-inch border edge around the wrapper. Going to apply my sterile gloves in the same manner as before. I'm going to apply the sterile dressing as prescribed. I'm going to apply my tape to secure my dressing. I am going to date, time, and initial my dressing. I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to immediately document that I did the dressing change. I'm going to assess my patient's pain. I'm going to ensure that the bed is in the lowest position, leaving them with the call light. I'll perform my hand hygiene again, and then I will close the door for privacy.